Hi everyone, thank you for joining us for the live event. And I welcome you to this session, which will hopefully give you some tips and advice to help you prepare your interviews. Just a little bit introduction about myself. My name is Jiayi, and I did my undergraduate studies at University of Toronto with a double major in biochemistry and pharmacology. I then pursued medical school at the same institution, and currently I'm training to be a plastic surgeon at McMaster University. I've been quite passionate about medical school education as well as mentoring students who wish to pursue a healthcare profession. And this has been um, probably 7 or 8 years since I've been involved in this process. So today what I'm going to do is compile some of the questions that I had received and combine that with a talk that I routinely give at the Career Center at the University of Toronto. I've been giving this talk for the past 2 or 3 years on an annual basis, but this year, because I'm doing a surgical rotation in Australia, I'm not able to give this presentation in person, so I thought I would put it in the video format for you guys. So the interview process for medical school is extremely important. After you made your cut to be an interviewee based on your MCAT and GPA, this is obviously the most important determining factor. The purpose of the interview is really like a job interview, is to screen candidates who are obviously not a good fit, who raise certain yellow or red flags. And it also gives the candidates an opportunity to speak about the items on their application and give the school more time to know their personality, their background, and their experiences. Most importantly, you have to show the school what value you can bring to the program in terms of helping yourself to achieve your full potential, but also help your classmates, as well as help the school in terms of how you can improve their curriculum. So the school will know that you're worth their time and effort for their investment. So there are three things that you need to keep in mind to show your best self. Often I ask my mentors for interview advice, and the most important piece I hear is be yourself. But sometimes I think that concept is very vague and it's difficult to execute if you do not have a clear approach or plan in your mind. So for me to show my best self, I think there are three important things. Number one is to give a good first impression, because you really don't get a second chance at this. This means you have to be very professional and pleasant, and also dress very professionally as well. I think most people don't have trouble with this as long as you're not too nervous on your first encounter, which means you do need to require some practice before your interview starts. The number two thing is to show some consistency. After you've given a good first impression, you want to make sure you continue to give that impression throughout your entire encounter, whether it's with the program, with the interviewers, but also with other interviewees throughout the day. Many of those interviewees will be your future colleagues, and you can start to make some friends at this point. Number three, I think admission committee often assess your profile based on your reference letters as well, because they must rely on reference letters who are written by members of the medical community to better understand your values, your background, and your skill sets. So these are extremely important. So whenever you can, I think it's important to think about experiences or activities that may have been mentioned in your reference letters. So mention certain research experiences or clinical shadowing experiences, which you probably completed with your referees. So I think these are fair experiences to mention in your interview. So once again, to show your best self, I think you need to give a first good impression, show consistency in your answers and the way you interact with people throughout the day, and thirdly, think about experiences you may have encountered with your referees that you should highlight during your interview. So after I've given you a brief introduction about why interviews is important and how to really be your best self, I've compiled a certain number of questions which I think are must-known questions, and I hope to answer some of the emails that we received over the past week as well. If you have certain additional questions or need clarification of those questions, please email us, or you can post on our Facebook page, and we'll try to get back to you as soon as possible, hopefully in our next week's session. So the number one question most people wonder is, how do you answer "tell me about yourself"? This is a very common question that routinely comes up on a number of interviews, including interviews for residency application as well. To me, there are two basic approaches that could be either chronological or the categorical. I personally prefer the chronological approach because I think it's easier to follow the train of thought. You could start talk about your birthplace, where you were brought up, where you went for school, what subjects you learned, what are your hobbies outside school, and what are your long-term career interests and goals. There's also the categorical approach I think some people prefer, which could include your personal attributes, your social attributes, and your professional goals. I think either approach is reasonable as long as you practice and polish your answers. Another question is, why medicine? I think this question should have already addressed in your application, your essay, and in fact, in none of my interviews, this question ever came up. But I think a reasonable answer would be, when did you get interested, how and who have influenced you, and perhaps share a story or experience. I think as long as you share a real story, the admission committee would be satisfied with that answer as long as it's a real story. It does not have to be anything paramount. And then it comes to the strength and weakness question. I think the strength question is often easier to answer because we all know about the CAMETS rules. Hopefully you guys have read about that. In fact, quite recently, the Canadian Royal College have mentioned there should be a standardized training of those CAMETS competencies across all the programs for medical school, but also various other specialties. I think to have standardized training across specialties is very important because when it comes to fellowship and job application, your hiring institution already have a good understanding of your level of training and your skill sets because you have gone through a standardized training program across the country. So I think this is a fairly simple question to answer if you look through the CAMETS rules, think about a particular example that may apply for each role, and make sure you articulate very well during your interview. In fact, CAMETS roles are really the attributes you look for in an ideal colleague. Who do you want to work with? Think about that person and try to be that person. When it comes to weaknesses, I think sometimes people struggle because they don't want to mention something that's going to hurt their application, but they also don't want to mention anything that sounds like a cliche or very repetitive as an answer to the interview committee. For example, most people might say, I often try to be a perfectionist, or I try to have too much on my plate. I think these are valid answers, but perhaps they've already been heard by the committee a number of times and doesn't make your story very memorable. So I think you want to mention something that's genuine, but at the same time doesn't affect your ability to work in a professional setting, or doesn't affect your ability to, take care of a patient, to work in a team, to conduct research projects. So certain things you could mention may include, social fears, or a certain language which you learned, or public speaking skills. In fact, one of my friends, he started a dance club at U of T because he's very passionate about dancing. But the weakness he had mentioned was he is probably the worst dancer in the group, but that's why he started the club to improve on his skills. So I think as long as you mention something genuine and unique and what you're trying to do to improve on that, I think you'll leave a good impression with the admission committee. But also, it's important to be self-aware of your weaknesses and actually doing something to improve on that. Another extremely common question I think almost always comes up is conflict resolution for both medical school and also for residency application. I think it's usually a case of miscommunication. Typically, people who come from different backgrounds, speak different languages, went through different training processes, may have different ways to approach the same problem. So I think in most working environments, people are well-intentioned, but they do make irrational decisions at times. Perhaps they're under pressure or there's not much time to think. So to effectively resolve a conflict is not to escalate the conflict, but to be patient and improve on the communication process. Try to understand all the parties involved and try to think from other person's perspective. Hopefully, without that, you can reach an ideal solution. And sometimes the solution may not work in your favor. It might be a compromise, but I think that's okay to share with the committee as long as you talk about what are your thinking process and how you arrived at that solution. And it's also important to think about what you can do in the future to prevent the conflict or how to better resolve the conflict. Once again, this is a question I think about the time you had a miscommunication and how you dealt with that. Another interesting question might be, or another question that I got asked is how to answer why not another healthcare profession. I think most people talk about being a physician is very rewarding because they're able to help other people. But in certain, in all healthcare profession, we're trying to help people, whether you're a nurse, a pharmacist, a physiotherapist. But you need to think about what's unique about being a physician. Perhaps it's being able to get involved in the various stages of treatment of the patient, including performing an operation, prescribing medication, diagnosing the problem, and also enrolling patients in research projects to be able to help other patients. So I think that's something unique about being a physician. But this doesn't mean physician is a leader in every clinical scenario. It really depends on what the problem the patient is facing. At different stages of the treatment of the patient, you'll see various other healthcare professions play the role of the leader in the care of the patient. You may be able to prescribe a wonderful medication for the patient, but the patient may not be compliant. And quite often, the nurses are the experts to execute your plan and convince the patient to take the medication. So you need to think about what's unique about different healthcare professions and why, again, you want to be a physician. One person asked, what would you do if you cannot be a physician? And how to answer that question. I think this is a good opportunity to once again re-emphasize and restate why you want to be a physician and what values you bring to the profession and to the community. And then pick another profession which closely involves those mentioned qualities of a good physician. You can mention a teacher, a engineer, whatever you want to mention. Because once again, you're trying to exercise the same value as a physician, and you're trying to do it in another profession. I think this makes your reasons of why you want to be a physician very memorable to the admission committee. And then you can once again mention in the alternative profession what you will do to help you contribute to the medical field. Another tough question somebody mentioned is how do you answer why we should pick you over other candidates? I think first of all the candidates who are able to make to the interview stage are quite excellent, and that's based on their academic track record as well as their CVs, and they're excellent people to work with as your future colleagues. I think first you must acknowledge those are excellent candidates, and it's very hard to be able to directly compare yourself to them without knowing their entire application. But what you can do is once again mention something that's unique about yourself that you think most other candidates may not have. Perhaps it's your background, it's your long-term commitment to pursue a career in medicine. Perhaps you started at a very early age. Maybe you had other medical experiences that other people may not have. And the reason you became interested in medicine is fairly fascinating. And once again, you can also tell the committee what are some of your specific skill sets that allow you to bring specific and unique values to the program. So talk about something that's unique about yourself, which you think may not be possessed by other candidates. But once again, acknowledge that everybody is quite excellent. And then there's a few questions that you must prepare on your own. And I think will help you to answer them if you think about them. I would say think about them now. So for example, you maybe tell them about a time you regretted something, tell them a time you lied, or tell them a joke. These are questions that I think it's difficult to come up with an answer on the spot, but would be very helpful if you prepare before and practice. In terms of ethical scenarios, I think we've all heard about the book Doing Right by Philippe Hebert, who's actually a lecturer at U of T, and we were taught by him as well. The four important ethical principles being mentioned: autonomy, beneficence, maleficence, and justice. I think they're an important part to answer the question, but perhaps comes later in your approach to the ethical problem. I think at first you would have to evaluate the situation and what's the problem at hand. And then you must seek advice from experts who have been in this field for a while. Because I think at this early stage in our career, our experience is quite limited, our knowledge is very limited. Even though we've gone through medical school and currently in residency training, there's always someone else you can look up to as a mentor, someone else you can look for when you need some advice, because there's still so much we don't know. And then you think about the alternative solutions to the problem and weigh the pros and cons based on the four ethical principles, and communicate your decision-making process with all the members of the team, including the medical team. It's typically if it's a medical question, involve the patient, their family, and then mutually come up with the solution to the problem. And afterwards, you must have a way to monitor the results and think about how you can improve on that the next time. So I think it's important to read the book and really understand the four principles, but I think the are more important in the later stage of answering this type of questions. Another question I got was, what are the advantages of having an international background? Sometimes people have the misconception because you come from an international background, you did not grow up in Canada, perhaps you do not know the culture here well or the medical system well. Perhaps you're disadvantaged in some way to become a physician. How would the committee look on that? So to me, I think there's a few advantages of having an international background. I think if you've dealt with different patient populations, you've seen various other physical and psychosocial determinants of health, which may not be apparent in the general patient population in Canada. But as we know, it's such a multicultural society, you bring a different perspective to look at the patient population at large. So I think there's certainly advantage to that. And typically from a different background, you probably speak another language, and once again, it's able to break language and cultural barriers and help you to communicate with different groups of patients. So I think if you're an international student, you really have come a long way and overcome many hardships and obstacles to be where you are. And to be able to make it to the interview stage, I think you're already telling the committee you're being very persistent and you're very hard working through the entire process. And in fact, I think if you haven't been in Canada for so long, it really showed you're a fast learner and being very adaptive to the educational system here, and as well as to have a good understanding of the medical system. So I think these are very important qualities to be a good future physician, and I think they will play at your advantage. So I think that's all we have time for today. There are other parts of the presentation I want to share with you, perhaps at another time. Or if you email info@mdconsultants.ca, we're happy to email you the slides. And I should mention, recently I met once again with one of my mentors, Dr. Kevin Jones. He's an orthopedic oncologist at Salt Lake City at the University of Utah. What really helped me in my interview was his book, What Doctors Cannot Tell You. It's a book composed of some personal reflections as well as patient stories to help everyone understand how to break a bad news to patients, how to help patients understand their diagnosis, treatment options, and prognosis, how to help patients interpret scientific literature to better help in their care, and ultimately how to tell patients what you don't know, but what you can offer with what you know, and to what level of uncertainty patient would be acceptable to accept more novel treatments. So I think this is a book you guys should check out if you wish. The name once again is called What Doctors Cannot Tell You by Dr. Kevin Jones. That's all for today. Thanks once again and good luck.